committee that includes representatives from each of our academic and health institutions across the state. And really the way that this started was through support of our chancellor. When he first arrived here in Texas, he was asked by one of the local United Ways here in the Austin area about what was actually happening in early childhood across the community and across the state. And his team reached out to various folks who study early childhood across the state and to ask more. And when they reached out to me, I was able to tell them a little bit about what was going on at the University of Texas at Austin. But I've since learned that there is so much more going on. But I knew way too little about what was going on across the state. And so it was from this kind of bit of ignorance on many of our parts about how much great work is going on across the state that this initiative was launched. And for the past 2 years, representatives on the steering committee have been coming together to learn more. And we did a scan of each of our institutions to find out what is the work that's going on that really focuses on children from the prenatal period all the way up to age 8, is how we define early childhood, so that we could understand both the basic science, the intervention, the policy work, the medical practice, there's the pedagogy. There's so much going on and such variation. And we identified various, what we're calling areas of excellence that are strengths that the university UT system really has, and opportunities for collaboration so that we could start to work across institutions. We found that within each institution, there's a strong connection to their local community and a lot of involvement at the state level, in addition to playing a role at the national level in helping to inform both our knowledge and our practice and our understanding of policy and the impact that we can have on improving the lives of children and their families. And one of the initiatives that has come out of this is to launch this webinar series, where every month a different institution will host the webinar and spotlight some of the work that's going on in its institution. This is the first of many, and we hope that you will join us along the way. And I'm very excited to be joined by one of my colleagues, Frances Champagne, as we kick off this event. We're going to focus on the earliest part of early childhood, both the prenatal period up through age 3, because we know that it is this earliest period that sets the stage for so much of our future health and well-being. And Dr. Champagne is a professor of psychology here at UT Austin, and she runs, I'm going to make sure I get it correct, the Epigenetics Development and Neuroscience Lab here. But she's a world-renowned scholar of really helping us to understand how children's brains develop, what their environment does to that development, and how we can both strengthen and protect children so that they really get off to a healthy start and thrive. Today, she's going to be talking about the prenatal and postnatal determinants that really impact children's healthy development. And it's just a great example of how the work across the system focuses on this real basic science, understanding at a genetic or epigenetic cellular level about brain development and child development. And I will then talk about policies and the policies that can help to create the environment that reduces stress for families, that makes it so that they can also have the resources and skills and knowledge and support that they need in order to help their children thrive. So this is the range of the sort of thing that we do here at UT Austin, but also across the system. So thank you again for joining us as we kick this off. and welcome to you all. And I'd like to introduce now Dr. Frances Champagne.
Okay, hello everyone. Let me get my slides up. Okay, so thank you, Cynthia. It's a delight to be here, and I'm very much looking forward to hearing about some of the policy work that you're doing. And I really think bridging the basic science and the policy is such an incredibly important initiative, and something that I hope that we can cultivate in the years to come. So my lab is interested in a number of questions about how early developmental experiences can affect the brain, affect behavior, affect health over the lifespan. And in the coming years, and certainly we've already dug into some of this work, we're interested in a number of factors in the environment that can influence infancy and childhood, including poverty. So we're working with the Baby's First Years study to examine the epigenetic effects of poverty and of poverty interventions, and see how those kinds of programs can lead to biological changes that I'll talk about in a little bit. We're also interested in very adverse forms of early experiences in the form of childhood abuse and neglect. And we're currently working with a number of collaborators who've been studying children who've been exposed to abuse and neglect and who are now in their 50s and 60s. And we can look at how these effects manifest across the lifespan and affect the aging process. And we're also interested in the interface and the interaction between the social and the physical environment. And so often we separate out these types of influences, the effects of stress, socioeconomic variables, and the physical environment. But of course they often co-occur. And there is, I think, much more interest in the interplay between the physical world and the social world and how that's affecting child development. This is something that we're exploring nationally, but also in the Austin area, to see how families are impacted by air pollution and by the characteristics of their family and neighborhood environments. Now, though these types of experiences are very, very different from each other, they all have a common thread in that they lead to lasting biological changes in children. And one of the ways in which that biological change manifests is through epigenetic factors. And this is an area that my lab has been exploring, and that many labs across the country are interested in. Epigenetics refers to factors that control genes. And so, yes, we have DNA, and DNA in itself can predict different characteristics, a lot of physical characteristics associated with genetic variation. But we have the ability to moderate and modulate gene activity through a number of biological factors. So we can change our genes so that they become more active or less active through a number of molecular changes. And it has become increasingly apparent that the experiences that individuals have at various times in their life, even well into adulthood, can lead to epigenetic changes, and that these epigenetic changes might be that very important bridge between the experiences that we have and biological, behavioral, and physical changes that can occur because of those experiences. So I think epigenetics has been a very interesting way to think about gene-environment interactions and to think about the biological embedding of the world around us. And I think provides a very dynamic framework for thinking about the interface between the environment and ourselves. So though much of our ongoing studies are focused on infancy and childhood and the experiences that occur then, of course, this initiative, this center, and my work also thinks about how how these factors start even in the prenatal time period. So there of course is a whole area in the science of early development focused on the prenatal origins of health and disease. And certainly the experience of mothers, the experience of both parents in the period before you're even born can have a very significant effect on developmental outcomes. And we've been focusing a lot on how stress, immune dysregulation, toxins, drugs, mood, and diet can lead to changes in offspring development through changes in the prenatal environment, changes in the functioning of the placenta during that period, epigenetic changes that can occur both in the placenta and the brain, and what these mean for offspring development. And I think this is a very important area. And I think the prenatal period is really setting the stage for infancy and childhood. And so once we start characterizing the experiences that are occurring postnatally, we realize so much is being set before you're even born. And so in terms of brain development, we have steps like neural tube formation, the basic formation of brain regions, neural migration, structural formation in the brain, and even refinement and pruning of the neurons in the brain occurring, even at 28 weeks gestation. And myelination of those neurons is occurring from week 28 to 40. And so there's a lot that's going on in setting the stage for the brain and behavior before you're even born. And of course, the pace of this change is quite high. And so any disruption that occurs during that period is going to have lasting biological behavioral effects that can affect an individual across the lifespan. Now, just to give you an example of some of these types of effects, we've been really interested in looking how mother stress during pregnancy, and this is self-report stress, can affect infant outcomes and particularly reproductive outcomes as well. So this is just some data illustrating a very interesting effect of prenatal stress, which is an effect on the ratio of male to female babies, right? So, and here we've grouped stress, and stress is a very broad term, but we can have psychological stress, so mood dysregulation, how stressed you perceive yourself to be. There can also be physical stress, so metabolic disorders, hypertension, those kind of things are a manifestation of physical stress. The more stress you're under, the less likely you are to give birth to a male. The more stress is associated with a higher likelihood of giving birth to a female. So even something as fundamental as the sex of the baby can be influenced by stress. And this is not stress in the extreme. These are stress in mothers that are feeling everyday stressors. But not some sort of trauma. And so even within the normal range of stress, you're seeing a very profound biological effect. Now, another effect of stress, an effect of a lot of different prenatal exposures, is preterm birth. And so we see that mothers who are physically stressed or psychologically stressed are more likely to give birth preterm. Now, in the US, 10% of babies are born preterm. So this is before 37 weeks gestation. Worldwide, it's estimated there are about 15 million babies born preterm each year. And preterm birth, of course, is associated with complications. In some cases, that can be lethal. So it's the leading cause of death among children under 5 years of age. So understanding the determinants of preterm birth, understanding the biology in which that is affected by being born preterm or whatever is predicting preterm birth is incredibly important. And so I think thinking about ways that we can reduce parental stress is going to be profoundly important in improving mortality rates and of developmental outcomes more generally. Now, Psychosocial stress, of course, is a manifestation of our social world. But of course, we have these physical stressors in our environment and many toxins as well. And so for many years, my group and other groups around the country have been looking at a number of different pollutants and how they affect the infant and child brain. And certainly, there's no shortage of different pollutants in the environment. So we have, here's an example of bisphenols. They're used in the manufacture of plastics and are consumed when we eat from containers made of plastic. There's air pollution. There are flame retardants. There's no shortage of toxins. And these all lead to epigenetic and effects on brain development. So working with the Columbia Center for Children's Environmental Health for many years, where they were looking at a cohort of children born to mothers who'd been exposed to high versus low levels of bisphenols, you see that there are sex-specific effects, and particularly with boys being most profoundly affected in terms of behavioral disruption. And these are disruptions that last well into school age and can impact school performance. And so not only our stress levels, but the pollution that we're exposed to can affect infant development. And this can manifest at an epigenetic level. So if you measure cells from cord blood of infants born to mothers who've had high levels of bisphenol exposure, you see that those males are very much affected. So male babies have higher levels of DNA methylation, which is an epigenetic mark that shuts off DNA. And this is shutting off genes that are really important for neuroplasticity. And so these toxicological exposures are going to impact brain development, impact the plasticity of the brain, and impact behavior in the long term. Now, policies that might reduce one exposure often lead to the increase in other types of exposures, which leads more work to do in terms of characterizing the effects of those exposures. Bisphenols are no exception to that. So many of the plastics that we use are BPA-free, which is not BP-free. So we're replacing, or companies are replacing the bisphenol A's in plastics with other bisphenols, such as BPF and BPS. And these may too also impact the brain. And so these are some of the studies that are ongoing in my lab and other labs across the country to understand how these chemical exposures are affecting mothers, affecting the baby's development, affecting brain development, and what this means for understanding cognitive and neural delays in children. Now, another factor that is impacted by the environments we experience is our aging, right? So aging is not just about being later on in years. Aging is a process that starts probably even before you're born. And so epigenetic age is a measure of biological aging. So some people age epigenetically well, which means their biology suggests that they're younger than their chronological years. But if you experience a lot of stress and adversity, particularly in early life, this can lead to epigenetic age acceleration, which means your body is aging quicker than one would anticipate based on your chronological age. So this, much like telomeres, is a way of thinking about the biological burden that we carry because of the exposures that the individuals have. Now, there are factors that can age accelerate individuals and decelerate. So the one, I think, wonderful thing about epigenetics is its plasticity, it's changeable. And so we know that there are many factors that can accelerate biological aging, such as infections, stress, metabolic disorders, neurodegenerative disease, and other physical factors. But of course, physical exercise, healthy food intake, and recently there's been a lot of studies showing that interventions focused on social support can also decelerate this aging process. So we may be able to identify at-risk individuals by characterizing their epigenetic age acceleration and target those individuals for intervention and factors that will decelerate their aging so that they can anticipate a longer period of health during their lifespan. Now, these stressors that are occurring prenatally can establish a pathway or a cycle that will repeat over subsequent generations. And I think one of the challenges that we have from the basic science perspective is to understand these cycles, and from a policy perspective to understand how we can interrupt these cycles. But the adversity that is experienced prenatally can be compounded by factors that occur in early childhood, such as childhood adversity, poverty. Of course, in adolescence, this may continue and start to manifest in disease states, which then further accelerate your biological aging, and into adulthood. This may lead to stress during your reproductive years that affects the next generation, and the cycle continues. So anywhere we can interrupt these cycles and decelerate the aging process by providing more social support, reducing stress levels, reducing exposure to environmental toxins, is going to be really important for interrupting these cycles. Now, I think much of the work on early environmental determinants of health and development suggests that there are sex differences in response to prenatal exposures, and with males being particularly vulnerable. And there's a lot of ongoing work trying to understand the mechanistic basis of that. Certainly, there is a coordination of maternal physiology, the placenta, the fetal brain, in determining long-term effects when we're thinking about prenatal development and the baby. And so thinking about interventions that focus holistically on health of the family, health of the mother, are going to be very important for fostering good, healthy childhood development. But we can also think of the role of postnatal experience in modulating these prenatal effects. So how can we intervene if we haven't been able to take a preventative framework when it comes to the prenatal period? And so colleagues of mine at the the Nurture Science Center at Columbia have designed some interventions that just illustrate what can be done. And so for preterm babies that, as I indicated, are at very high risk, one of the sources of that risk is not simply that they were born preterm, but then they are also deprived of the caring social, emotional interactions that occur during the postnatal period. And so by restoring some of those, by exchanging smells, by exchanging touch, and holding and skin-to-skin contact, there's a lot that can be done to reverse or prevent some of the damaging effects of preterm birth and of prenatal factors. And so they find, using a family nurture intervention, that there's robust increases in brain activity in the frontal cortical regions. And this correlates with better neurodevelopmental later in life. So identifying places where we can intervene and implement policy changes that can better support development will mean a lot for these individuals and for the 10% of babies that are born preterm. And so the epigenetic framework that comes with this work is really a way to think dynamically about the way in which our biology interacts with our environment. So it's not just a matter of our genes dictating how we develop. There's a really wonderful crosstalk between the environment and our biology that is changeable and modifiable. And I think that's really one of the critical features of this epigenetic framework, is that there are interactive and bidirectional effects of genes and environments. This allows for interventions and for changes in the environment to really change the developmental trajectory of infants. It views developmental outcomes as plastic and reversible, which is important from an intervention perspective. And from this intergenerational framework, it really thinks about how things are passed from generation to generation in a far more dynamic way, right? It's not just about passing down blindly biological information, but there's a modifiable process where we have to think very thoughtfully about how the environment can manifest in generations to come and interrupt those cycles. So we start in development at this top of what's often referred to as the epigenetic landscape. And we can go down multiple routes down that landscape. And really, I think the challenge is to make sure children and babies are moving down that developmental landscape in ways that will foster healthy neurodevelopment and healthy physical health, that will set them up for healthy lifespan, and healthy lifespan of generations to come. So with that, I'd just like to, of course, acknowledge all the people involved in my work at Columbia University and here at the University of Texas, and of course, Whole Communities Whole Health, which is an initiative that that's supported here by the University of Texas at Austin to better understand and better help support the healthy development of children in the Austin area. So with that, I will hand it back over to you, Cynthia.
Well, thank you, Frances. I'm always I love your work. And like you said, it's so great to be able to pair the science of the developing child with policy, because it really is your work and the work of others like you that has informed so much of what we're doing. So I will try to share my screen now. And I just wanted to remind folks that we will have time for questions. And I see that you are putting them into the Q&A box, and I appreciate that. And we will be sure to get to these questions, and please just continue to add them there. So I'm going to talk today about the newly kind of created Prenatal to 3 Policy Impact Center that's here at the University of Texas at Austin. And really the whole purpose of this Impact Center is to be a resource for states as they try to really make sense of and to bring to life the science of the developing child through policy. And let's see if I can actually make my slides work here. And we are guided by all the work that Frances and her colleagues around the country and across the globe do to help us to understand that our brains are, expecting this environmental inputs when we're born. It starts prenatally, of course, but this idea that if we can provide safe and stimulating and nurturing, loving, warm environments for our littlest ones, that sets them on a path of healthy development in which they'll have, strong self-regulation, executive functioning. But if we neglect to do that and children are exposed to chronic adversity, that this really leaves them in this constant survival mode that has long-term implications for all of the health and well-being. And as Frances pointed out, children are incredibly resilient. We should never write any child off thinking that they have been harmed or damaged and there's nothing that we can do. But the science does tell us that it's very difficult and quite expensive to try to undo or change some of the things that we could have done to intervene early. And it's important to note also that there's great inequality in terms of who it is that is exposed to safe, stimulating, warm, nurturing environments as opposed to early adversity. And too frequently, it's our children of color, children from lower income households who live in environments or neighborhoods that expose them to things that make it difficult for them to thrive. And that this is really a result of policy choices. And so we focus a lot on how we can use policy to try to reduce some of those inequities. I think another important point that guides our work is that the research is really clear that we cannot just think about focusing on the children. As Frances' work points out, just the prenatal period is such an important part of children's development. And she mentioned, but she has a lot of great work in the area that demonstrates that it's both moms and dads, their environments even before conception that will influence the well-being of children. And that continues long after the children are born. That our parents need the knowledge and skills and resources that will allow them to be the parents that they aspire to be and that their children deserve. But we also know that there are many others who care for our children and that they need similar sorts of supports. And a study that we did on childcare providers here in the Austin area, as well as in the Seattle area, showed that about 40% of childcare teachers reported depressive symptoms and or food insecurity. And so these are the ones who are caring for our kids on a daily basis, but they're struggling themselves, and that's going to make it difficult for them to do that important job. The other thing that we have learned from all of the research that we have done is that it's important to understand that there is no magic bullet. There's no single program or institution that can do it all. We can't rely on childcare. We can't rely on our pediatricians or one particular parenting program in order to make it so that kids really get off to a healthy start and thrive. That we do need a system, a broad set of policies that ensure that our basic needs are met, that work actually pays, that parents can balance those important roles of both working and caring for their children and for their other family members. So those are the broad policies, and we need targeted programs that really address specific needs that we've identified in children. And with that combination, each of those sorts of policies will actually be more impactful and be a stronger return on our investment as well. And policymakers often care a lot about costs. We're using scarce public dollars, and we need to make smart investments. But the research could not be clearer that if we can invest early, we will have bigger impacts that will have longer term benefits, and that our return on investment will be higher. And this kind of very blunt comparison of looking at the cost of childcare per year in Texas at around $9,000 as compared to incarcerating someone in Texas for a year around $22,000. Please do not think I'm trying to suggest that any child that doesn't get childcare is going to end up in prison. That's not it. But my point is that we are going to need to invest in our society. And if we can invest more upfront, there will be fewer costs to pay later on. So I'm going to move now into the work of our center, and just in the interest of time, I'm going to kind of speed through some of these slides, but they will all be available to you. And one of the things I wanted to point out here is the second, that I noted this in the very beginning of my talk, but we are really guided or driven to do this because there's such differences in outcomes across race, ethnic groups, and across socioeconomic statuses. We know how important those earliest years are, and that we have to invest in children and their parents. And we have to pay attention to policies that will close gaps and not just perpetuate the status quo. I also wanted to note that we're here in an academic institution. Evidence research is all so important to our work, and we're guided by the evidence. But we also understand that there are limits to the evidence base. It hasn't answered every question. We don't know everything that actually works. There are a lot of things that probably do work that haven't been studied. And there's a lot of questions still unanswered that help us to better understand for whom the policy works best and under what circumstances. So as committed as we are to demonstrating what we know from the evidence, we're also committed to building that evidence base and making it more equitable. At the Policy Impact Center, we have introduced 4 resources to the field, and I'm going to focus mostly on our state policy roadmap today. But because a lot of folks on this call will be academics, I also wanted to introduce you to our new Prenatal to 3 policy clearinghouse. So we've conducted comprehensive reviews of several dozen policies that are state level policies, and all of the research that we have looked at is reviewed and is there, and it's a summary of all the causal studies, and also points out where we the gaps in what we actually know. Most of our clearinghouses have to do with programs, and so this is one that we created that focuses specifically on policies, and I would encourage you to use that, and especially for those of you who are students or can send your students there. As one of my colleagues said, that this is a list of dissertation topics for the next 50 years. But our state policy roadmap is what I'd like to share with you mostly today. And I'm going to use Texas as the example, but we've created state roadmaps for all 50 states and DC. And again, we began with the science of the developing child. What is it that we are trying to do? What are the conditions in which policy can help to create in order to make it so that children can thrive? And from that science, we went to work to identify what the most effective policies are that really move the outcomes in those areas. And then we're monitoring states' progress toward adopting and implementing these policies, and also monitoring how generous they are and how wide the reach is. And we're tracking the well-being of families and to looking at 20 different outcome measures by race and ethnicity, so that we can see that our policies over time will make a difference in the lives of these children. These are the 8 prenatal to 3 policy goals that derive directly from the science of the developing child. They're broad and making sure that folks have the resources that they need, that they can work, that they're from birth, they're healthy, the parents are healthy, the children are healthy, that they're in nurturing child care settings when they're not with their families. And really importantly, that when there is some sort of need or developmental delay, that we identify it early and we connect that child and their parents to the services that they need. So that's what we're trying to do. And the literature led us to 5 effective policies and 6 effective strategies that actually create a difference in these outcomes and those 8 policy goals. And the difference between policies and strategies is a little bit, of a small distinction, but from a state policy perspective, it's a little bit larger than it might seem. Our policies usually are broader in their reach, but the way that they have been studied tell us what states should do. They provide legislative guidance in terms of, the action that states can take, kind of the floor of the benefit that's needed in order to create that impact. Whereas our effective strategies have been demonstrated to have a positive impact on the lives of infants and toddlers and their parents. But the research doesn't necessarily provide guidance for states as to exactly what they should do. So with our strategies, we've identified kind of a range of what states are currently doing and demonstrate kind of the states that are in front of the pack on many of those areas. But the policies range from making sure that families have access to the health care that they need, so expanding Medicaid, that making sure that they have access to the benefits that they're actually eligible for. We use the example of SNAP, but reducing administrative burden is important across the policy landscape. A paid family leave policy of at least 6 weeks following a child's birth or adoption or foster placement, a state minimum wage of at least $10 an hour, and a state earned income tax credit that's refundable and at least 10% of the federal earned income tax credit. And the 6 effective strategies include making sure that we're screening folks universally for a comprehensive look at the social predictors of health and well-being and connecting them to the services that they need, that families have access to affordable child care. Group prenatal care provides a social network for many moms, and it's a preferred outcome for some. Our home visiting programs that are evidence-based that improve parenting outcomes. Our early Head Start programs that focus on making sure that we both engage the family and provide them with the resources and connections to the community that they need, that we focus on that nurturing relationship between the teacher or caregiver and the child, and that we really care for the caregivers. That's what Early Head Start does, as well as our early intervention services. So for children who have identified developmental delays, that we get them the services that they need. And this, again, is the example of Texas's roadmap. But for each state, what we've done is identified both Each of the columns represents one of the 8 policy goals that we're looking at that create those conditions in which children thrive. And each of the rows indicates how that policy or strategy, which goal it impacts. So health, Medicaid expansion impacts 5 of those goals, paid family leave impacts 6 of those goals, and so on. And then the check mark indicates whether the state has adopted and fully implemented that goal at a level, or that policy or strategy at a level that will make a difference. And we see that there's wide variation across states in terms of the policies and strategies that families have access to. In Texas, we don't have any of the effective policies. We're kind of in the middle of the pack on the effective strategies, but each state can see where they are. And the goal is that over time, all states will move toward adopting these policies and strategies and creating the system of care for children. I wanted to share with you all the new Prenatal 3 policy roadmap that we have on our website, which is at pn3policy.org. And I think that that is in the chat or Q&A for you. But although the actual roadmap itself is 300 pages, which is a little bit long, that we break it down. It's a compilation of each of our goals, the 8 policy goals, and each of the 11 effective policies or strategies. So for each goal, we identify why is that goal important and how are states actually meeting that goal now, and what are the most effective policies or strategies that will influence outcomes there. And we also look at the innovative initiatives that states are undertaking to try to improve outcomes that we're waiting to see the evidence grow so that we can add it to the list. This is just an example of what I call our impact table that would be in the goal of increasing household resources. So we demonstrate how each of the policies in the one strategy impacts household resources. And an example is that the research demonstrates that access to paid family leave will lead to a $3,400 increase in household income over the course of the year. Each of these points, we're hoping that folks who are interested in studying this, interested in advocating for policy change or making decisions about policy, will have information from the causal studies, the most rigorous information that we have about the benefits of those policies. We also, like I said, have a policy profile for each of the 5 policies and 6 strategies. What is it? What impact does it have? What do we still need to learn about it? And then we look across all the states to see how generous states are, what the reach of the policy is. And there's all sorts of information that we're sharing so that you can understand how your state is relative to others, and that academics can use to understand how combinations of policies impact outcomes. Again, for each of the policies or strategies, we demonstrate the impact that it can have on the various goals. And I'm just going to briefly show you what the state policy roadmaps look like for each of the states. This is Texas as an example, but like I said, each state is available online. And one of the things that we recognize is that policy is a long game, that it does not happen right away. And sometimes it takes multiple years, multiple sessions, introducing policy, voting it out of committee before it will really even receive, a kind of reading across both chambers. And so this is just a snapshot of where the state stands with regard to each of the effective policies and strategies. And so, but we go into great detail, both in our data interactives on our website, as well as in subsequent pages on the state policy roadmap. So this is an example of Medicaid expansion in Texas. And Texas is one of the few states that has not yet expanded Medicaid. So you can see that we're down here in the among 4 other states that has really had little to initiative to adopt or implement Medicaid expansion. Although the word is that this legislative session, we may have more discussion about it. So that will be interesting to see. But for each policy and strategy, we also provide more information and so that you can really understand both the generosity of the policy, the reach of it, the need for it, and so forth. And for this example of Medicaid expansion, you can see that we provide the income eligibility limits for parents as a percent of the federal poverty level. A lot of folks are not aware that if the state has not expanded Medicaid, that no childless adult is eligible for Medicaid in that state. But even among parents, there's great variability across states in the income eligibility if you have not expanded Medicaid. If you have, income eligibility is 138% of the federal poverty level, or a bit higher for DC, which is that one at 221%. But Texas is here at 17%, meaning that a family has to earn 17% of the federal poverty level or less, so no more than about $300 a month, in order for the parent to be eligible for Medicaid. And this translates into, and Texas is obviously one of the highest rates of uninsured, and close to half of low-income women in our state of childbearing age do not have any health insurance coverage. I'm going to go to some of the other policies as examples here. Here we are with the state minimum wage. Texas does not have a state minimum wage that's higher than the federal minimum wage. The research says that at least $10 or higher is needed in order to see the impacts on the well-being that we would want. And Texas is one of several states that have actually enacted legislation that prohibits local communities from setting their own minimum wage. So there are some states in which the state itself has the federal level of $7.25, but some cities have set a higher level. But Texas does not allow for that to happen. So the minimum wage across states ranges from $7.25 up to $15 an hour. And you can see that this has a big impact on the proportion of parents with young children who actually earn less than $10 an hour. And about 14% of Texas parents with young children under age 3 earn less than $10 an hour. And an increase in the wage would really impact all of them. So this is not just something that impacts teenagers. When we look at one of the areas in which Texas is a yes, here's an example of where we have identified programs that have been rigorously evaluated and demonstrated that they have impacts. In this case, Family Connects, which is a program offered right after birth, and Healthy Steps, which is a program offered in the pediatric setting. And Texas has both of these throughout the state and actually puts some state funds into it to support it. In child care subsidies, we have a lot of information on child care subsidies in terms of what states are doing. Unfortunately, the research provides less information on what states really should be doing and what they need to do in order to ensure that families have access to affordable care that is high quality. But what the kind of federal guidance is that the states have to set their reimbursement rates at least at a level that's a family could afford 75% of the market, and that it should be a market rate survey that's no more than 2 years old. And Texas does not do that. And we provide information here. And we also provide information on kind of what we call the distribution of the total cost of care by states, so that each state can understand, one, if you look at the length of the bar, that's kind of the total cost of care. And the first two blue are really the part that any provider would get, both the state's contribution in this kind of brighter blue, and the darker blue is the expectation of what the family would need to pay. And this blue-green, this is the additional fee. It's the amount that a family would have to pay to the actual child care provider that's different between the base reimbursement rate and what the total cost of care is. Not every state allows for providers to charge that, but many states do. And Texas is somewhere in the middle in terms of the total cost of care. But it's towards the kind of low end with regard to its reimbursement rates, but it's really at one of the very highest in terms of what the parents are expected to pay of the total cost of care. So this just provides information to states about how they could change their child care subsidies so that it can make it more affordable and accessible for families. This will be the last example I'll show, but in group prenatal care, this is a program, the program that's been evaluated most rigorously is called Centering Pregnancy. And here, Texas is one of 8 states that actually has it part of their kind of state's billing model where they will provide an enhanced Medicaid payment for group prenatal care. But unfortunately, this isn't used very widely in Texas. And Texas also has one of the highest proportion of women who are pregnant who don't receive adequate prenatal care. And then finally, for each state, we show a list of kind of how they stand on these 20 different outcome measures. And all of these outcome measures have been proven that they can be impacted by all the policies that we just reviewed. And they are very predictive and indicative of families' well-being and subsequent well-being as well. And so these are the things that if you can measure in your state or across Texas, especially by race and ethnicity, to really understand it will help you to understand how families are doing, and you should see changes over time. And Texas is a laggard in several different areas in terms of making sure that among those who are eligible actually receive their benefits of SNAP. Another area is in the interactions that parents have with their children on a daily basis, either reading to their children or doing these nurturing behaviors of singing songs and playing games like peekaboo and so forth. We're really one of the lowest states in the country in these sorts of engaging behaviors that we know are so important. But anyway, states can see where they are kind of towards the left and lagging, or where they're towards the right and seemingly having better outcomes than many other states. As we move forward, we're going to do a lot more to try to learn more about the evidence base as it continues to grow. We are also doing deeper dives on the cost and funding and return on investment for each of these policies. And like I started with, it's so important that these policies actually reduce disparities in outcomes. And so we are looking at each of these policies from an equity lens so that we can understand the ways in which it might better promote equity and the ways in which now it might actually exacerbate inequalities. And so I do encourage you all to visit our website to learn more about what we're doing and to stay in contact with us through that. But I'm going to stop sharing now so that we have an opportunity to answer your questions. And I really appreciate the opportunity to share this with you. So I know that we're running shorter on time than we hoped, but there have been a lot of questions that have come in. And Frances, while you were talking, there were several that were some specifics, but some that were kind of more general that I would love for you to try to address. We know that in policy and the outcomes, there are big differences across race and ethnic groups in both kind of exposure as well as in outcomes that children experience. But what about all the findings that you were just showing? You showed some sex differences, but are the impacts of the environment similar across race and ethnic groups, or can you help to describe those differences?
Yeah, many studies are underpowered to really get at that question in any detail. So my experience, when working with the Columbia Children's Center for Environmental Health, is that, you have a very low SES population, and either all white or very heavily Hispanic Dominican population. And so that's a issue in a lot of different studies. Now, certainly preterm birth occurs at higher rates in Black and Hispanics. And again, this is probably due to the levels of other stressors and environmental exposures that contribute to that outcome. But something that we've been really poor, I think, at really getting at because of the lack of engagement with a more diverse population in the science.
Yeah, I mean, we have the similar issues with data. Even, I'm a demographer. We're looking at census data, and we still have a difficult time sometimes breaking out all of the outcome measures that we know are so important within a state by race, ethnic group, or by parents' education level, and that it's not satisfactory to say that this is a sample size problem, because we know that we need to look at these issues in so much more depth. But right now the data don't exist, and that's just really a shortcoming from the science perspective, I think.
And I think it would be interesting to reframe and stop thinking maybe necessarily as race or ethnicity as being the variable of interest in predicting different outcomes, but the experience of racism as the predictor, and that race and ethnicity are just a proxy for the degree to which you've experienced those. So I think a lot of people are interested in moving in that direction and really trying to explore the mechanism.
Yeah, no, I think that's the crucial element, right? That it is this, and your work and others have really shown, especially in the prenatal and at the birth period, the various impacts. So once you've controlled for any other thing that could actually, we can measure, there are still differences that we can only attribute to racism. And there's a whole host of questions that have come in that are very specific to myelination and various technical things. But one of the first questions, this person's been waiting nearly an hour to get this addressed, so I want to make sure that they get it. You said that stress leads to having more girls than boys. Now, in Texas, we're not allowed to talk about how babies are actually made or really born here. But can you help to clarify when the stress is happening and how that could actually happen?
Yeah, we think it's a difference in implantation rate, so that if a mother is stressed, a male embryo is just unlikely to implant, so she's much less likely to give birth to a boy. And this holds with a lot of epidemiological and longitudinal studies.
Yeah, that our boy babies seem to be more fragile to their environment than the girl babies.
Yeah, they do.
And then the other thing, and we're going to wrap up because I know we're over, but I did want to just kind of put this out there. With measurement in general, this is a real disconnect between what you do and what I do. That you get to measure things you get to look at people's brains, through brain scans and measure their blood, and obviously with consent. But I'm hoping, and I know the field is working on it, but that we're going to be able to get some of these meaningful outcomes that really tell us whether kids are off to a healthy start or need greater support than some of our blunt instruments that are probably good proxies, but that we measure at this population level with very lagged time and so forth. Do you have any insights into how we can kind of make that a reality?
I think stronger use of technology, availability of technology to measure change and developmental outcomes in real time, I think could be a real asset here, because it's something, the availability of wearable devices or sensors and all these things, the cost is coming down. And this is just, it's non-invasive, and it really gives you some insight into what's going on in terms of stress levels, in terms of meeting developmental timelines and so on. So I think technology shouldn't just be for, gifts for Christmas or Hanukkah or, whatever holiday you're celebrating, but something that's used as a tool. So I think that there's a real opportunity. And I think some of the, certainly you can't bring everyone into the lab and do a brain scan. So, but there's a lot more portable technology for measuring brain development, and I'm excited. Now there's someone who has a van that can just drive around with a scanner in their van, and there's other less invasive methods of analyzing brain development. If those could be made to scale, you could really get some insights. So I think there's potential. It's just probably coordinating and making those available.
Yeah, and affordable that we can capture them. But well, I know that I could listen to you talk forever, and I know there's a lot of additional questions that I wish that we could answer for people. But we will be sharing the video and the notes from this so that everyone has access to it. And I wanted to thank you, Frances, for taking your time at the end of a very difficult semester for everyone, students and faculty, for sharing this with us today. And I want to invite all of you to our next Early Childhood Scholar Series for the UT system, which will be on January 14th. And it will be led by one of kind of our state's champions and kind of national leaders in this field, Susan Landry, and several of her colleagues who will really look at the impact of early childhood education and think about how we can really take this research to practice for our Texas schools and families. So please join us for that event. We'll be sending out invitations for registration soon. And I wish you all a very happy holiday and restful and holiday new year, and hope for new beginnings in lots of ways. So thank you all for joining us today. Bye-bye.